Hi everyone, welcome to today's video where we're going to be talking about personal protective equipment, or known as PPE, and today it's about gloves. I'm Emily, the health education specialist here at Live Well and HealthVisions MD, where our motto is better care, less medicine. So, why are we talking about gloves? Why is it so important? Well, we're seeing it everywhere today. We're seeing people use them in grocery stores, in healthcare, at home. So we want to make sure that you're using them properly and safely so that way we can prevent the spread of this disease too. And the disease that we're talking about is COVID-19. It's on everyone's minds. So, Dr. Fabry, what do we know about this so far and how is it spreading?
Yeah, that's a great question when it comes to why we wear gloves in the first place. I think this has a lot to do with it, right? The spread, we want to stop it. There's a lot we still have to learn right now. We don't know everything, but every day new information is coming in and we update and we change the way that we do things based on that information. Right now, what we do know is that this virus is spread definitely through a respiratory droplet, okay? This is the droplet that travels through the air from your mouth to another person or a surface when you're talking, breathing, coughing, sneezing, all right? So if you've ever been having a conversation with somebody and that little droplet of spit comes out and lands on you, kind of gross, right?
Yeah.
But it's a fact. It happens, okay? It happens in almost every interaction that you have with somebody inside of a 6 feet radius, okay? So the droplets tend not to travel further than 6 feet. So that's where this information comes from when they're talking about precautions and staying away from other people. This is why. We want to prevent that from happening. Now, you also could transmit this through other bodily fluids, right? So we talk about respiratory droplets, but even just saliva or mucus, right? If you sneeze and that kind of gets on the countertop, or blood, right? So these are things that we want to avoid making contact with. And there's a lot of studies that have come out over the last few days looking at how long does this survive on different types of surfaces. And I think for the most part, what we can take away from this is that 24 hours is about the average time frame. Some a little more, some a little bit less. But think about that. Somebody sneezes on the table and you lean onto it or you interact with that surface, you're transmitting that virus to yourself, maybe even the next day, okay? So this is where something like gloves can come in handy and they can protect you.
Yeah, that's a really great point, Dr. Fabry. So we really want to make sure that we're aware of those surfaces and cautious of them as much as possible because we don't always know who's come in contact with it or what has.
Definitely.
And so that's why we chose today to talk about gloves and making sure that we use them properly so we can prevent the spread of this. And one thing I want to know, is it still valuable for people to wear them if they're not a healthcare worker?
I think that's a really great point. And there's a lot of conversations we have about that, right? Because in healthcare right now, the gloves are in short supply.
Yeah.
And so maybe less and less people are telling the average person on the street, how should you use your gloves? Because maybe they even prefer that you would donate them to healthcare at the moment. But there are some subtle differences about why you might use them in healthcare versus why you might use them for yourself at home. For example, in healthcare, a lot of the PPE we're wearing is preventing us as providers from spreading an infection from person to person among our patients, okay? We're talking to a lot of different people, and so really like a mask, for example, it's keeping my breath, my sneeze, my cough isolated to me, but it doesn't protect me so much from something coming in from the outside, right? So when it comes to the gloves, yes, okay, so we have some of that in healthcare. When you're wearing gloves as the average person outside of the healthcare environment, you're wearing those gloves more to protect you. But the danger here is that the glove used improperly could also cause you to put yourself at greater risk. Okay, and so that's why we're making this video today, because we want to make sure that you know exactly how to use these things so that you can have a game plan, okay? Yeah. So we're going to start by talking about how you put gloves on. I think that's the best place to start. And before you do anything with personal protective equipment, you always wash your hands. And so it's very, very important that you're washing your hands properly. But this is a step that should prepare you for the activity, and it's the step that you should close the activity out. For example, like when we take our gloves off again later today, Emily will go ahead and she'll wash her hands again. you know what? There's a lot of people out there that just, I call it watering your germs, okay? Not washing their hands properly. Squirting some soap on and quickly rinsing it off is not washing your hands. You have a lot of surfaces on your hands, so proper hand washing. If you're not doing that, again, you're putting yourself and other people at greater risk. So this is something that we want to focus on, and maybe we'll make a video about that also. But I have heard from a lot of different people that proper hand washing is not something that's commonly followed, okay? So let's talk about putting the gloves on. Now we've got fresh, clean hands, so we'll go ahead and we'll pull the first glove out of the package or out of your pocket if you're doing this at home, right? You're gonna grab the glove by the palm side and you're going to pull it up over your hand. Now, if you notice, she didn't get that glove quite up on all her fingers. We're not gonna then take our hand up and touch the glove and adjust everything yet, okay? We wanna try to keep this whole process as clean as possible. So we'll go ahead and we'll go for the second glove. And you wanna do this in one movement. Again, grabbing the palm side, pulling that glove on as best as you can, okay? So now that you have gloves on both hands, you can go ahead and you can fix all the fingers. You don't want to touch your skin, you don't want to reach up underneath anymore. At this point, the outside of your gloves, you protect that, okay? You protect that, it's a barrier. You don't touch yourself, you don't touch your skin. Now, if Emily had long sleeves on, what she would also do is go ahead and pull that glove up over the sleeve. We'd want to tuck the sleeve up underneath the glove. Now she doesn't, so it's not as important. But the problem is if you have long sleeves on and you pull that glove up and the sleeves come over the top of the glove, you're essentially dirtying the sleeve. And then you go ahead and you remove the gloves later and you've got a dirty sleeve that's now contaminating your hand and you end up still getting sick. So we really want to be careful to pay attention to those contact points, okay? Now, once the gloves are on, we want to make sure that we continue to keep our hands away from our face, okay? The gloves do not have an antimicrobial property to them. They are not like washing your hands or putting hand sanitizer on. They are a barrier. So keep them away from your face. Continue to limit surfaces that you touch. Even though you have that protection, doesn't mean that you want to be constantly using it, because every time you get exposed to another surface, you take another chance of exposing yourself to getting sick, all right? If your glove is torn or contaminated, we're going to change it immediately, okay? So it doesn't help you to have a tear in your glove walking around continuing to doing what you're doing. So always have a backup pair, okay? And we'll talk about that in a little bit as well, okay? So let's talk about taking the gloves off, because this is where I think most people fail at doing this properly. So you've done your trip to the grocery store, you get home, it's time to take your gloves off. So the first step that you're going to notice is that you're going to grab the palm. Okay, so she's grabbing the palm. She's not grabbing here. She's not touching her skin. Everything is still contained. Grabbing the palm and peeling that glove off.
This hand is still really wet.
And then she closes her hand around the contaminated glove. Now, the left hand there would be considered to be clean, right? And so how will she get this glove off? We don't want to touch the surface. So we'll touch the clean side. So she'll take her fingers and she'll slide inside of the cuff and she'll go ahead and she'll peel that glove away. Perfect. So now you see she's contained the first contaminated glove inside, made a little package, and then guess what we're going to do? We're going to dispose of this immediately. I've seen so many people, even inside of the healthcare field, they get done and they set their glove on the counter while they go to wash their hands or whatever they're going to do there, right? So dispose of them right away. Put them in the garbage can. Get rid of them. You're done with them anyway. You're not recycling. You're not reusing these. And then, of course, we don't want to forget, wash your hands right away with the same process that we used before. Okay, getting all the surfaces, 20 seconds. This is just as important because you really don't know. You were protected. You had that barrier, but you really don't know. Was there some contamination that you missed?
Or did you accidentally touch some part of your skin when you had the gloves on?
Exactly. So you can never be too careful, especially in this environment now. Have a game plan. I think this is where people screw up, right? Okay, gloves, I got the general idea. They go ahead, they put them on, they throw them away, and you know what you do? You end up missing a step. So it wouldn't hurt to just sit down for a minute and write it out. Here's what I need to do to put the gloves on. Here's what I need to do to take them off. I don't think that should be overlooked.
No.
So make a game plan, and that will make sure you're fail-safe, especially if you're one of these high-risk individuals where this is way more important, okay? Have a game plan. When it comes to tears, we talked about that a little bit. So what do you do if you're in the supermarket and you're lifting a product and the glove tears? Or what do you do if you're trying to open the door of your car and it catches, right? This is where these kinds of things happen. And these gloves are not very strong. They tear often. I tear my gloves probably almost every time I put a pair of gloves on. I tear the first one. I tear the first set. You pull it a little too hard. So what do you do in that scenario? If you were in that scenario, if you had a game plan, you'd have another pair of gloves right in your pocket. So what would you do? You would go ahead and you'd remove your gloves that you have on properly. Now let's just say that you tore the right glove.
Yeah.
Well, that's easy enough, because then you could just take it off and you could discard that one and you could put this glove on your other hand. Or if you're really worried about it, go ahead and remove both gloves properly. Throw those in the trash can and wash your hands, and then administer your second set of gloves. So if you have this game plan, you won't have to figure it out on the spot. You'll know exactly what to do, okay? Now guys, I hope that this video has been helpful. Feel free to ask questions below. Feel free to call our office if you have questions. We want you to be educated on this stuff. I want everybody to feel confident and supported as we go through this outbreak, okay?
Exactly.
We have so many resources. We do these videos so that you guys have educational resources. We have telemedicine, so if you have a symptom, you're kind of worried about it, but you don't really want to come into the office for it, or you're not sure if it's important, doesn't matter. Telemedicine. I've seen patients, they're sitting in their cars talking to me. I've seen patients that have been at work on their own. We're able to see them from anywhere, assess their symptoms, monitor their symptoms, and then if we need to do an in-office visit, we can do that. If we need to triage this and send it to the hospital, we can do that. We can order prescriptions for you. So there's a lot of things that we're doing to keep you safe, okay? We also offer testing here in the office, and so many other resources. We have volunteer groups we're working with that are picking up groceries and prescriptions for people that are high risk. So please, if you have any questions, if you have any concerns, reach out to us. Facebook, through our office, through our online patient portal. Any of these things are available to you, and we're on standby just waiting to help however we can, okay?
Exactly.
So look guys, keep an eye out for the next video. Everyone stay safe, and I look forward to seeing you all soon, and I look forward to this being over soon.
Yeah, definitely. So stay safe out there, wash those hands, and take care of everybody.